Welcome to our Cancer Wellness Speaker Series. I'm Lori Ball. I'm the founder of Faith and Gratitude and an ovarian cancer survivor. Faith and Gratitude is a nonprofit organization dedicated to providing empowerment and education to cancer patients. In this episode, we are bringing a very different format to you. We are interviewing for the first time in person. We will be meeting Dr. Veronique Desaulniers, better known as Dr. V. We hope you enjoy the segment. Dr. V is the founder of Breast Cancer Conqueror and the creator of the 7 Essentials system. Dr. V's signature approach has inspired and empowered thousands of women across 64 countries worldwide. Her mission is simple yet powerful: to change lives one breast at a time. Having personally triumphed over breast cancer, not once, but twice, Dr. V brings a deeply empathetic understanding to those navigating their own healing journeys. Her best-selling book, Heal Breast Cancer Naturally, has topped Amazon's charts in 10 categories and in 5 countries. This segment is designed not only for those dealing with a breast cancer diagnosis, but for anyone dealing with any form of cancer. So without further ado, I'd like to welcome Dr. V.
Thank you so much for having me, Laura. I'm really excited to have you in my home.
Oh, it's so nice. Thanks for inviting us.
Yes.
So first off, let's talk a little bit about your past, your experience as a bioenergetic chiropractor. Can you tell us a little bit about that?
Sure. So most people understand what chiropractors do, but I basically took it a step further, and this was like back in the 80s. So I was kind of a wellness warrior. Not too many people understood bioenergetic medicine back then. So basically, my practice at the time was not just pain relief, but it was looking at the whole person, the whole body. And we know that we are electrical beings. And so when we can tap into that energy and measure it and see how the body responds to different remedies and different tools that we may give it, then we know exactly what the body needs. So it was a very busy and happy practice, and I enjoyed taking care of my patients for many, many years.
So your journey with breast cancer, not traditional. Can you share your story and explain why you chose the less conventional path?
Well, as I mentioned, I was a wellness warrior. I ate organic before organic was in style and had home births and, was a chiropractor. So took nutritional supplements and exercised and thought I was doing everything right. But 23 years into my practice, I was getting ready for work and I was in the shower and I felt a lump in my left breast. And right away I knew that something wasn't right. So I chose not to go conventionally. And, the idea of me being the, wellness warrior at the time was shocking. How could somebody like me develop breast cancer? I mean, I thought I was doing everything right and, breastfed my children. And, here I was with a lump in my breast. So that took a big adjustment for me to, kind of wrap my brain around that. What was I doing wrong? What did I miss? So I had to take a deep dive into, my life and, really take an honest look at myself and what was going on in my life. And I said, okay, if I'm going to heal this, and I knew and I understood because of the field I was in, that cancer was just the tip of the iceberg, right? It's not the cause, it was just a symptom. So why what was I doing that allowed the cancer to show up in the first place? And so I just sat down with pen and pencil or pen and paper and said, what is it going to take for me to get well and reverse this dis-ease in my body? And it literally felt like a download. I just started writing and I knew nutrition was important. I knew detoxification and the emotions and the dental and all these pieces came together, and that's how I came up with the 7 Essentials system. So I started applying that and checking off the boxes. And that first journey took me 2 years. It was, it was life-changing. I learned a lot.
About yourself.
About myself.
Right? About yourself.
About myself and my body, my life. the things I needed to change. So it was a big adjustment, but I learned, and that's the thing with healing any kind of disease in your body, whether you're dealing with cancer or any kind of disease. It's about a transformation. What is it going to take for you to move this dis-ease out of your body so that your body has the ability to heal? Because we know it does. So fast forward 9 years. So that's 2015. And I had started sharing my healing journey. I'd stopped practicing chiropractic, and I took a couple of years off. And a lot of messages came my way. Colleagues and friends and patients said, why don't you share your healing journey? You could help a lot of other women. So 2012, threw up a website, had no idea what I was doing. And so 3 years into the journey, known as the Breast Cancer Conqueror, I was working from sun up to sundown. I was neglecting my health. My hormones were off. I wasn't sleeping. I was stressed. And I created the perfect storm for breast cancer to show up again. So this time it was very devastating because I was the face of healing breast cancer. And, how could I be coaching these women and telling these women they can heal when in reality I'm facing another diagnosis with cancer? So I just, again, had to buckle down and say, okay, what am I doing? What do I need to change? So I took a really deep dive personally into each of the 7 essentials, and I had to make a lot of adjustments along the way. And, in those 9 years, a lot of things had changed in the cancer world, in the natural cancer world.
Oh, yeah.
A lot more information. The truth about cancer was out, and so there was much more awareness in healing cancer
And more
naturally.
people speaking out about it too, right?
Definitely. So I changed my life. I stopped coaching our clients, and I trained coaches to do the coaching for me. So I had more time for myself. I did, a lot of emotional healing. I did, like I said, I took a deep dive into each of the 7 essentials and just really took the time to heal. And, I had to drive an hour and a half one way to get a vitamin C IV, but that's what I had to do because I was living in the mountains in North Georgia. So one of the visions that I had during those 3 years of healing was that I would be on stage, because we were hosting live retreats at the time, and I was going to share my success story with, the women in the audience. So I had that vision of sharing that, and that was always, top of mind in my meditations. And then August of 2018, I was able to share that, and then the rest is history.
What a blessing, though. One, that you found it yourself, right? And the first time, and then you did this deep dive, and then to come to find the second lump, same breast or the same breast. Yeah. So able to do it again. Look at you. What a little warrior you are. And what an inspiration to really all of us, honestly.
Oh, well, thank you.
So I suppose then what inspired you to create the Breast Cancer Conqueror, it was intuitive, really, right?
Right.
It was intuitive.
And it was, it was my desire to share my journey with others because I'm like anybody else. I'm nothing special, and I had to do the work to, take the deep dives into the emotional aspect, the physical, spiritual, all of that. And if I could do it, then other women could do it. And, it's about paying it forward. If you hear somebody has had success in reversing a disease, you want to know how they did it. And maybe if they did it, then I can do it. And so it's been a blessing. I'm very humbled by the fact that, my team and I could not have done it without my team. We've been able to support so many women with such great success stories. So,
well, I mean, it's amazing to me, honestly. And as I said, finding you when I was starting my cancer journey, mine was ovarian, but still knowing that if you can do it twice, I can do it at least once. So it was very, very, very inspiring to me.
Great.
So a key part of your mission is to empower women to take control of their health and make informed decisions. So can we talk about each of the 7 essentials, maybe a little more in depth?
Sure. So essential number 1 is let food be your medicine. And there's so much awareness now about food, right? People are much more aware than they were, 20 years ago. Is there perfect anti-cancer diet for everybody? No. The one diet that's good for you is what's unique for you. And that's one of the things that I learned in my second healing journey. I mean, I'd been juicing for 30 years, and during my second healing journey, I ramped up the juicing, but I was not feeling well after the juicing. And I'd listened to Dr. Thomas Siegfried and the metabolic approach to cancer, Dr. Nasha Winters, who, I had consulted with, and it just made total sense to me. So I really cut back on my juicing, did more blending. I did a hardcore ketogenic diet for 6 months. I don't recommend it long term, but it really helped me to reset my metabolism. And I also did some testing. There's a brilliant test called the Nutrition Genome, which we recommend to all our clients. And what this test does is it looks at your genetic weaknesses and what foods and supplements best support your body. So you know exactly what your body needs. So for example, I discovered with that I had a genetic SNP that prevents me from manufacturing and absorbing vitamin D. So I have to supplement with liposomal vitamin D instead of just the powdered vitamin D and K. I don't create enough glutathione because I have a genetic SNP that prevents me from detoxifying properly. I learned that I don't convert beta carotene from carrots and sweet potatoes to vitamin A. So I have to supplement with a liposomal vitamin A. So, it's all these little nuances that really make a difference, and it really transformed my health and my life.
So let me interrupt. So this test, is it a blood test or is it a saliva test?
So I think it's a swab or a saliva. Yeah. Very simple. In 5 weeks, you have your results and you see what your DNA and your genes are doing and how you can best support them.
Okay. Very good.
So that was very helpful. So, back to, do I stay vegetarian or vegan, or am I carnivore? How do I know? This is a great tool. So essential number 2 is to reduce your toxic exposure. We know we live in a toxic world, but we can't live in a bubble. We do our best. But especially with breast cancer, it's important to look at what we call xenoestrogens, or chemicals that will stimulate and mimic aggressive estrogens in the body. So pesticides, herbicides, plastics, paraben, phthalates, all the stuff. We have to look at what we're putting on our skin, because everything you put on your skin is being absorbed into your body. And then look at detoxification. Even though we try to eat clean and live clean, it's important to detoxify your body. So sweating is one of the best ways. Getting in a sauna, laying on a biomat, infrared heat, all of that, because they found that in a study called the BUS study, they looked at blood, urine, and sweat, and they found that sweat had the highest concentration of environmental chemicals and heavy metals from the sauna.
Interesting.
Yeah, so sweating is very important. I'm a fan of coffee enemas, so coffee enemas are great to help detoxify the liver. And, there's colon cleanses, there's liver cleanses, kidney flushes, there's all kinds of things that you can do to help really support that detoxification process.
So interesting. I've never really, I've read so much. This is a lot of information, but this is why we're here, about the coffee enemas, but never pulled the trigger.
Oh, really?
I never did.
Okay.
I never did.
It's time. It's time.
Maybe time.
Yes. It's very, there's a lot of fear around that, but once you do it the first time, you think, wow, it's not too bad. And you feel so good after you do them.
Yeah.
And especially on a healing journey, because you're, detoxing, you may be killing off cancer cells. So you've got to flush your system and give your liver some support.
Yeah.
So
makes so much sense.
Yeah. Okay.
All right. Essential 3.
Yes. So balancing your energy. So that kind of goes back full circle to bioenergetic chiropractor. So, we are energetic beings, right? We're 1 billionth physical matter. The rest is all energy. And so how do we do that? Well, chiropractic, it helps to balance your nerve system, number one, because they found that if your nerve system is not balanced, so think of your nerve system like there's an accelerator and the brake. There's the parasympathetic and the sympathetic. And if the sympathetic, the pedal to the metal, is always revved up, that can turn on oncogenic genes, that can turn on those cancer pathways. So it's very important to balance and get that parasympathetic stimulation in there. Acupuncture is great to balance your energy. Meditation, massage. One thing that really helped me also was using the Heart Math app to get into that relaxation mode. That's how you learn to stimulate your parasympathetic, your vagal tone, because I thought I was a good meditator until I put the little clip, the sensor on my ear, and I realized that I was staying in the sympathetic mode. So it really helped me to dive deeper into my meditation practice so I could really get into that parasympathetic mode, because you can't heal if you feel like you're being chased by a saber-toothed tiger, right? We've got to get into that calming mode to ramp up our immune system.
Yeah. It's so true, right?
Yeah.
Because we think we're going on that healing journey route. We think we're on the right path, but are we? Right? But until we really know.
Yeah.
Very good. Very good.
And so one more thing for balancing your energy are hormones. Very important. Now, most women with breast cancer have probably been told, and ovarian cancer, that your hormones are driving cancer. So we have to shut down your hormones so the cancer can't grow. But in reality, your balanced hormones do not cause cancer. We need our hormones for our brain, our bones, our heart, everything. And so if we shut down those hormones, then what happens? It affects our immunity, we get osteoporosis, brain fog, all of that. And there's so many side effects to those medications. And I'm not saying that you would never need to take that. Sometimes if the cancer's out of control, you may need something to put the fire out, but, discuss that with your doctor. But many, many women are realizing that, hey, it's not my hormones, it's the environmental hormones that are driving this. If I keep my body clean, if I learn how to balance my hormones properly, then it's not driving the cancer.
Makes so much sense.
Yeah.
Essential number
4. Yes, that's a big one.
It's a good one. They're all excellent, but number 4 is a big one.
And actually, if I were to start over, I'd probably put number 4 as number 1. So essential number 4 is to heal the emotional wounds. And that's where we look at the connection between our thoughts and our emotions, our beliefs, and how it affects our healing, how it affects our immune system. The fancy word is psychoneuroimmunology, right? Your brain affects your nerve system, affects your hormones, affects your immune system. You look at doctors like Dr. Joe Dispenza. You are the placebo.
One of my favorite books too, right?
I know. That was a game changer for me to understand how much my brain and my thoughts had an influence on my body's ability to heal was just astounding.
Oh, I know.
So looking at your childhood wounds, your teenage wounds, your adult wounds, the stressors that you're dealing with today, if you don't learn to manage your stress properly, again, you're going to be in that fight or flight and your body's not going to heal properly. There's a study that I like to mention all the time. Is there was an 11-year study done on women with breast cancer, and they found that if they, number 1, learned to manage their stress, and number 2, had community support, they had a 75% decreased risk of dying from breast cancer. 75%, just from those 2 things, managing your stress and having that community support. So, your emotions and how you live your life, your belief system is so, so powerful when it comes to healing.
And I think just a lot of people in general, women for sure, they don't think of it that way. They don't think of something like your emotions as needing to be healed. But they do.
They do. And it's, A healing journey is a transformation, right? Everything that you lived how you lived your life before your diagnosis is what allowed the cancer to show up. And so now is an opportunity for you to change your life and how you lived your life so that you get better results and you come out on the other side a happier and healthier person.
So true. Essential number 5.
Yeah. So the dental aspect, embracing biological dentistry. Now, what do your teeth have to do with your health, right? Well, I learned that very early on, the early 1990s. I had 16 amalgams in my mouth, and I happened to know a dentist who had studied under Dr. Hal Huggins, who was the pioneer in biological dentistry. And of course, he lost his license. He had to go to Mexico to practice, but he was really the pioneer who was telling people the mercury in those silver fillings were cancer causing, especially breast cancer. Mercury is a metalloestrogen. It mimics and stimulates estrogen in the body. So he did the procedure properly, the right way, measured with an amalgameter and used the right technique and everything. So from that point on, I started teaching my patients about biological dentistry, way back in the early 1990s. So it's an important aspect because if you still have silver fillings, that's problematic, especially if they're sitting on the meridians. Now, the acupuncture meridian system runs through all the organs and through the teeth. So if you have a mercury filling or if you have a root canal, so a root canal is like a dead tooth, right? And the substances they use in the root canals are very toxic, and there's always a pocket of infection at the base of the root. Even if you don't have symptoms, it's always there. That's been proven. And that drips toxicity, suppresses your immune system. Another factor with your mouth is gum disease. If your gums are bleeding or if they're swollen, then you have bacterial pockets in your mouth. And some doctors are even calling breast cancer an infectious disease because the bacteria in the mouth are now being found in the tumors in the breasts. Because that's how toxic it is. It's dripping down the lymphatic system. So very important, and I've seen that time and time again. Women who resisted. Nobody likes to go to the dentist, and if especially if you have a mouthful of work and root canals, it's daunting and it's expensive.
It's expensive.
But when they bite the bullet and they do it, their numbers drop and they get better.
And they heal.
Yeah.
So did you have all of yours reversed? All of yours removed?
Totally reversed, yes. Another thing I discovered in my second healing journey was the problem with cavitations, infections in the bone where you've had extractions. And, I kind of knew about them, but I didn't really think that I had a problem with them. And sure enough, the 3D scan showed there was, problems. So I ended up going to Dr. Nunley in Marble Falls, Texas, and had cavitation surgery to remove all the infection in my mouth. And so far, so good.
So far, so good.
Yeah.
Like me, and I think you're the one who I first learned about thermography, breast thermography, and I really started studying. So maybe we can talk a little bit about breast thermography and also the leaching from some of the amalgams, and oftentimes the same side as the breast cancer shows up.
Yeah, definitely. So thermography is a great tool to look at what's happening in the body as far as inflammation. It's not going to diagnose cancer, but it's going to show you where there's inflammation because it reads the infrared heat coming off the body. And so the software translates it and puts it into a picture where you can see, red, and sometimes you can actually see the blood flow feeding the tumor. You can see if, there's hormone imbalances, thyroid issues. You see the jaw, definitely, and how that drips down into the breast tissue. So it's a great screening tool. And definitely, and you can do whole body on thermography.
I know. I love them. I think it's great, and it's non-invasive, right?
Right.
Okay, so we are on essentials number
6. Yeah. So that's about repairing your body with therapeutic plants and herbs. And, we can go down the rabbit hole with that. And again, there's no one perfect protocol for everybody. It's very individualized, but, look at the basics. We need proper nutrition because even if we eat well, our food is very deficient. So make sure you're getting magnesium and zinc and selenium. Those are, basic foundational minerals. Look at your vitamin D levels. If you keep your vitamin D levels optimal, you have an 83% decreased risk of even developing breast cancer and a much better chance to heal. So, you want your vitamin D levels to be between 80 and 100 mgs per ml. That's kind of the target for therapeutic use. There's a whole world out there of medicinal mushrooms and, supplements like, quercetin and poly-MVA, which is a alpha-lipoic acid type of formulation. There's salicinium. I mean, there's, lists and lists and lists of formulas and protocols that you can work with. But, make sure that you work with somebody who understands what is best for you. And don't stay on the same program month after month after month. It's important to change that around because otherwise, the cancer cells can become resistant, right? So we want to keep them confused and monitor. Always test, don't guess. And that's kind of brings us into essential number 7 about, early detection and monitoring your health. Because you have to measure to see if what you're doing is working, right? So I'm a real stickler. Make sure that depending where you are in your journey, that you're getting blood work done, checking your inflammatory markers, checking your vitamin D levels, your cancer markers. Thermography is a great tool. Ultrasound. QT is a new technology.
It's a new technology I've been reading about.
Yeah. Dr. Jen Simmons, who's amazing, former breast surgeon. Now she's, helping women heal with breast cancer. She's really, she's such a go-getter. I mean, she was a breast surgeon in Philadelphia, and she used to wear a button that said, "Say no to mammograms." As a breast surgeon. So, yeah.
How fun is that, right?
Very gutsy.
Yeah, very gutsy.
I'm not a fan of mammography. I mean, just because of the radiation and the compression and the problems it causes. Some women still choose to do that. If you do, that's okay. Just, prepare your body before and after. Make sure that you're doing things to, get that radiation out of your body.
So going back to keeping our bodies sort of guessing, not doing the same protocol day after day after day. I think so many of us just get our supplements out for the day. And, we've done the same protocol for many months, maybe many years for some of us. So maybe we should just really take a look at that again and just to see if it's something that maybe we need. Do you think, or what is your feeling too about muscle testing as far as like just asking your body, like, do I need this quercetin today? Do I need this level of vitamin D today?
Yeah, some people, I think muscle testing can be very subjective. So make sure if you do that you work with somebody who's very objective. This is where I really like computerized technology because it takes the subjectivity out of it. So you can test to see if that's balancing your body or not. Another really good test is called the RGCC test. It stands for Research Genetic Cancer Center. They started in Greece, so people know it as the Greece test. And it's a beautiful test. And there's more and more tests like it now. It's kind of a liquid biopsy where they draw the blood, they filter the blood, and they count the number of circulating tumor cells. Because even though the tumor's cut out or radiated or whatever, chemo, there's still some activity going on in your bloodstream, right? Doctors won't tell you that. You're no evidence of disease, so go on your merry way. But they don't tell you may have those circulating tumor cells that need to be addressed. So what they do is they filter your blood. They'll grow those cells in a lab, and then they'll test 50 different natural substances against your cancer cells. They also can test chemotherapy agents, 50 different chemotherapy agents. They can look at the genetics driving the cancer as well. And then you get your report and you say, okay, I have, XYZ cancer cells, and, these things are good for me. So I'll do a group of these for 1 month, and then I'll switch them over the next month and then the third month. And then you retest to see how things are progressing. So it's a great, great tool. I mean, I still get tested every 18 months now because my numbers are so low.
Yeah.
So yeah, it's a great tool.
Well, that's very good to mention that too. How does that particular test, how do we juxtapose that with the test that you had mentioned earlier in our conversation?
Totally different.
Okay.
Because the nutrition genome is a DNA test that looks at your genetic weaknesses.
Okay.
This is looking at literally the circulating cancer cells, and what do they, what best targets them so that they die.
You can eradicate them.
Yeah.
Okay. Can you think of any success stories of people who have followed your protocol?
Yes. Let me tell you about Tara Coyote. So Tara started off as a client. I think she had stage 3 breast cancer, and she was determined to do everything naturally. She was like, don't talk to me about chemo, radiation, surgery. No, I'm going to do this naturally. And she followed her program, did her coaching. She did really well. And then she came into some major stressors in her life. She had to sell. She was a horse whisperer and did horse therapy. She had to sell her ranch, and a lot of, stress in her personal life, and the cancer took off, which happens, right? Stress is going to drive the cancer. So it got to the point, she ended up moving to Hawaii, where she was from. And it got to the point where she was stage 4. And in the bones, I mean, her femurs were breaking, her sacrum, I mean, the lungs, I mean, it was everywhere. And fortunately, the doctors, the oncologists in Hawaii were a little softer and gentler with her. And they said, Tara, you have a choice. You can go to hospice, or you can try chemotherapy and surgery and radiation and see what happens. So she said, I'm not ready to die, so I'm going to do what I need to do, along with all my natural remedies and everything else that I was doing. And now she is no evidence of disease. She's written a book. She's actually 4 books now. She's coaching women, teaching women. I mean, she's fabulous story. But, I like to share that story because some of you out there listening may think, oh, I would never, ever go to chemotherapy route or whatever. But sometimes you just have to do what you have to do. And the tools are there for a reason,
yeah,
right?
I agree. And I think sometimes it would be nice to know that chemotherapy, radiation, surgery could be a plan B, right? I mean, it's always available.
Yeah. And, when I started this whole movement with Breast Cancer Conqueror, it was all about healing cancer naturally. But we did a survey probably about 5 years ago in our community, because I would notice more and more women were coming from the conventional world. And 70% of our clients were doing a combined
Like a more
treatment.
holistic
Yeah,
approach.
an integrative approach. So I said, okay, well, we need to adapt to that and support these women that maybe are in the chemo, pink movement and just conventional, but they're hearing about nutrition and they're hearing about other things. So let's invite them into the community and help them and support them, So
I agree.
Yeah.
I totally agree.
yeah, there's so many stories. So Lynn was diagnosed with breast cancer. She went conventional. And she came to one of her retreats because she just wanted, to prevent breast cancer from coming back, because the doctors told her she was fine. But I looked at her thermography, I looked at her blood work, we did the RGCC test. I said, Lynn, you have a recurrence. And sure enough, she had scans done. And so she really followed deeply the 7 essentials. She worked really hard, and as of, several years ago, 3-4 years, all her scans were clear again. And she's still, to this day, 8 years, 9 years later, she's still, she still follows our system, and she's done a great job, and she's actually taught other women. She's given the book away,
Just
so,
passing along the
yeah,
information,
yeah,
right?
yeah.
Just trying to provide that hope as much as we can.
Yeah. And if you go to the website, breastcancerconqueror.com, you'll see we've got video testimonials. We've got all kinds of stories from women all over the world. So
Yeah, and I think as a community, it goes back to even talking about a community. It's not a misery loves company, but at the same time, it's whatever we're learning and we're able to kind of formulate concise wording, I think, to help others is just what we're supposed to be doing.
absolutely.
It just feels like a blessing for sure.
And we learn from each other. I mean, I learned something new. I can't say every day now, but clients, say, "Did you hear about this?" Or I think we were just talking before the interview, right, about something.
Yeah.
So it's about sharing information, and there's so many advances that are moving rapidly now. It's great to share.
It's great to share, and it's a great time to be alive,
Yes.
right? It's a great time. So we understand there's been an addition to your team. Can you tell us a little bit about that and
Yes.
how this partnership has developed and where do we see it going?
So let's see. I've known Dr. Michael Karfelt for many years now. We did work together, summits, webinars, met him at conferences. We were in different, mastermind groups, and always really appreciated the kind of work that he did. He's a naturopath by training, but really in an integrative oncology way. He did a lot of his training in Europe. He's from Sweden originally. And we just, connected personally, professionally. And in the last 6-7 months, we decided that he would join our team. He has a fabulous clinic in Boise, Idaho. I just came back from there. I was there in November last year. And I was so impressed. And I've been to a lot of cancer clinics, and a lot of them are great. But I was really impressed with the therapies that he had there, things that you think you could only get in Europe. I mean, you name it, he's got it. And he looks at the body not just chemically, but energetically, genetically. He looks at all the facets. He basically follows the 70 Essentials, right? Just uses some different terms. And the success stories. The rating on his website under, I forget, it's doctoral or something. It's, where you rate your doctor, is 4.9 out of 5.
Wow.
And it's I don't know, I forget how many thousands and thousands of people. So, and so after recognizing that, my community needed, a place where we can really send them and feel like they're, really being treated well. So we decided to partner up, and he's kind of overseeing Breast Cancer Conqueror and giving us his input as well. And we're really happy to have him.
Congratulations.
Yeah.
What a movement though, right? You were able to meet Dr. Karfelt, and he feels as though that it was important to continue on a message with such hope.
Because, he, like he mentions, the majority of his patients are women with breast cancer. Unfortunately, it's, one of the more prevalent cancers. And, he's been such a great support, and we're, really happy to have worked together.
Well, it's exciting, huh? Something new on the horizon. Is there anything else you'd like to let our viewers know before we go today?
Yes. Always go back to the beginning of when you're initially diagnosed. Perhaps some of you listening are newly diagnosed and you're looking for answers. Maybe some of you have been on your journey for a while. The important thing to know is that, number one, you have time. Cancer is rarely a medical emergency. Sometimes it may be, but it's rarely. It's more of an emotional issue that needs to be addressed. So, you may have been given a whole slew of treatments. You need to do this, and now. But give yourself time to really let that diagnosis sit and understand that it's just a symptom. It's not the cause. It just means that things are out of balance in your body. And there's an opportunity for you to bring your body and your life back into balance. And it's an amazing journey. It's not just getting rid of the lump or the bump, but it's really about a transformation of your life so that you come out on the other side a happier and healthier you.
And one more thing too, I think there could be a book that you're co-authoring with Dr. Carfeld.
Yes, we are. That should be out in a few months. It's Breast Cancer Breakthrough, and it's about using conventional treatments and natural medicine and combining them to really be able to get the most out of your healing. Conventional doctors say, there's no proof that natural medicine works. Well, they haven't taken the time to do the research, because the research is there. The studies show that when there's an integrative approach like that, you have fewer side effects, and many of the supplements and nutrients actually help to enhance the effect of the conventional treatments, but with fewer side effects. And quality of life expectancy is much better. So we're excited about that.
Well, it is exciting. I found it was so important for me to kind of marry Eastern and Western together, just because I felt that there was so much you could do for yourself between all of the tests, and in my case, chemotherapy. But yeah, I think that's really exciting. So it's something to look forward to, a couple of months. A question that we would like to ask Dr. V also is her opinion on water fasting.
Fasting in general is great. Water fasting can be very, very powerful. I would recommend, obviously, if you're going to do an extended water fast, that you work with a practitioner, because there may be some things that they need to monitor. But fasting allows your body to go through the phases of what we call autophagy, right? It's going to recycle those old and dying cells, and it's really gives your body a boost and a breath of fresh air. So definitely fasting is great.
So what is the recommendation? My husband and I have been doing 3-day water fasts twice a year, and they're getting easier and easier each time. So what is your opinion with reference to 24, 48, 72?
Yeah, if you can start off and just do a 24-hour fast, that's great. If you can extend it a few more days, that's even better. The most I've ever done is a 10-day water fast. I did, squeeze a little bit of lemon in my water once in a while, a little bit of salt, but it's phenomenal. I mean, how your mind clears and your body feels, it's such a therapeutic thing to do.
Yeah, we really find the same. It just adds that whole level of clarity and dreaming and remembering dreams. And the more we've read about it too, we just really feel comfortable doing it and passing it along. So thank you, Dr. V, for being with us today. We so appreciate your time and your insights, and we look forward to the partnership and more that will be uncovered because of that. So in conclusion, if you have been recently diagnosed, please reach out on faithandgratitude.org, that's our website, to request your cancer resource guide. The Cancer Resource Guide is free to all those newly diagnosed, and we ship it for free all across the country. And to learn more about the 7 Essentials System, Breast Cancer Conquerors retreats and coaching programs, and an upcoming in-person retreat in Boise, Idaho, visit breastcancerconqueror.com.
At this time, we would especially like to thank our sponsors for making this speaker series possible.